Hello everyone, today I am talking about the eczema root cause checklist. What are some of the first questions you should be asking if you or your child has eczema in order to really understand the root causes of those eczema? These are some of the first questions that I ask if I'm working with an eczema patient or an eczema child. And so it's the questions I will ask the parent. And so these are the questions that you want to think about, if you have eczema, just to, think about what could be the root causes. And I think that's the most important thing is we're really getting down to the root cause. Because if you are addressing eczema by just putting topical things onto your system like topical steroids or even just topical moisturizers, you really aren't getting to the root cause of the problem. And what we really want to do is heal from the inside out. Okay, so let's go through this list. The first question that I put on that eczema root cause checklist was, do you have gut issues? Or are you not having daily bowel movements? Now, this is really important because if you are not exiting your toxins out via your gut or via your urine, where these toxins are going to come out is via your skin, okay? So if you are not having daily bowel movements, this is something we need to fix right now. If you are having bowel movements every other day, every couple days, this is really common for people in my practice when they first come to see me, is that they are having bowel movements, 3 times a week, and that just really is not acceptable, not normal. Other things you might want to look at is whether your poops are sinking down to the bottom. That's what we want. Are they a nice brown color? Do they look like a nice snake or banana? That's really what we want it to look like. And if it's looking like anything other than that, then we really need to fix it, because that may be one of the root cause problems, is that you are not having those daily bowel movements every day. Gut issues such as bloating, such as acid reflux, can really also indicate that the gut is dysfunctional and it's not doing what it needs to do in order to get those toxins out of the system, which is what we are trying to do. It's what your body was designed to do. So when your body isn't really allowed to do what it was designed to do, which is get those toxins out of the body, those toxins are going to try to come out some other way. That's your supplemental filter, and that is your skin. And so that's where you're going to see some of these issues pop up with eczema, but even with things like psoriasis and other skin conditions, okay? Second question, do you get car sick easily? Now, this is a really important question. It's actually one of my first questions I usually ask. Really common for eczema people to get car sick, to have motion sickness. And this was something I had when I had eczema. For those of you guys who don't know my story, I was born with eczema. And so I had really bad car sickness. I could not even be in a car without throwing up. And come to find out, this is a functional marker for us. If you get car sick, seasick, motion sickness, oftentimes it means there's a congestion in your liver, gallbladder. Sometimes you have gallstones. Sometimes you have gallbladder issues. Oftentimes we'll see that you're not pooping every day, and the cause of that is actually your liver, gallbladder. So I see this a lot in my eczema and other skin condition patients. This is something I personally experience. So it's one of the first questions that I usually ask when I deal with an eczema case or even a psoriasis case or other skin condition. And oftentimes the answer is going to be, yes, I do get car sick. And that really means that, okay, we need to look at the liver, gallbladder. We need to understand what's going on there, okay? Do you eat gluten, dairy, and sugar? Now, these are some of the most inflammatory foods that I notice for my eczema patients. If you eat these foods, these might actually not be the cause of your eczema. They could be, but they also could just be another problem that you're dealing with that is just putting more load and more burden on your system. So if you are eating those things, I usually tell people, whether it comes up on a test or not, usually I say, okay, we can test it to confirm if this is a problem for you. But if we don't find it on a test, I often still want people to avoid those foods if they have eczema, okay? Do you have metal dental fillings? They're called amalgams. So if you yourself have metal dental fillings, this could be a big problem. The other problem is if mom had them. If mom had them, well, these are made of 50% mercury, and these can leak into the body. They can leak through the placenta into baby and through breast milk into baby as well too. So these can be a big problem and something to also consider as one of the root cause issues for eczema. Do you like to eat tuna or other exposures of heavy metals? Tuna is found to have a lot of mercury as well too. And there's so many other exposures of heavy metals, which leads us to the next question, which is, do you filter your drinking and shower water? And that's because I do find a lot of chemicals, heavy metals, uranium, arsenic, but also a bunch of other chemicals in our tap water that could be problematic. So making sure that you filter those water sources. And then if you want to get your water tested, I actually do have a link, the link in my bio. If you go all the way to the bottom, there is a test called Tap Score where you can send your water in and see, how toxic your water is, and then make sure that your filter is also working well. Okay. Next question, do you use toxic non-organic products? Now, this is probably something a lot of us have already tried to clean up, but these toxins can really be present all over the place and we just don't know it. So really looking through the things that you're using, whether it be cleaning products, whether it be the things that you're putting on your face, on your skin. Sometimes some of the recommended products like Aquaphor, Vaseline, Cetaphil, have certain chemicals in there that are not are not the cleanest for us in terms of toxicity. So that's something to look into as well too, is whether you're using products that are toxic and clogging the system. And then lastly, the last question I put on here, and these are only 7 out of a lot of different questions that I usually like to ask at a first visit with a patient or a discovery consult where I'm meeting someone for the first time. The last question is, do you eat non-organic produce and processed packaged foods? So I do find a lot of patients with a lot of different pesticides in their system. I find people with lots of varying pesticides. So if you're eating non-organic GMO foods, then these could really be causing a problem. My eczema patients, in addition to heavy metals, I also see a lot of these environmental toxins. Now, is it genetic that these kids or these people are having a hard time detoxifying these toxins? Is it that we're filling that funnel too much with toxins? Well, we can determine that with some testing. We can run genetic tests. We can run, tests to check the environment. We can run blood, urine, poop tests to really see what toxins are in the system. So that's, these are some of the first questions I might ask. And then how do I prove that these things are going wrong? Well, we'll need to do some testing, and that's one of the things I really like to do. I like to collect a lot of data. I like to see the poops on a daily basis when I work with people, because those poops can really tell me a lot about what might be going on, how much you're releasing out of your body. So we give you an app to, check those poops and send them to us so we can actually see those poops on a daily basis. And so if you want to learn more about how to, number one, investigate and identify what are the root cause problems with your eczema, psoriasis, other skin conditions, or even just other chronic conditions that you might have, you can investigate, identify is really step one. Number two is really set up a strong foundation, and we will show you how to do that. And then number three is you now cleanse. And you really can't get to the cleansing part unless you do all of those. If you want to learn more about this, I am doing a free live masterclass this evening, and it is at 6:30 Pacific Standard Time. It is free, and the link is in my bio. I will be live, and instead of just an IG live like I'm doing here today, I will be showing slides. I will be really teaching in depth. I will be answering every question you guys have. I love teaching this stuff. This is how I healed myself of eczema completely. And this is where we really need to really focus when we're dealing with skin conditions like eczema, psoriasis, is what are the root causes and what is the body telling us? The body's already giving us so many clues to let us know what's wrong. And unfortunately, we're just not listening to those clues. Instead, we're just putting topicals on and we're doing injections and all these other things that really just don't fix the root cause. They really just, they're a Band-Aid for just keeping us afloat until things go really bad in terms of, it's not just eczema you're dealing with, but now you're dealing with hormonal issues and all these other issues if you don't fix the root cause. Someone's asking if hives are similar. Absolutely. Hives are similar root cause. We need to ask the same questions. And oftentimes with hives, there is something that's causing the trigger to cause the funnel to overflow. Again, I will explain this more in detail at my masterclass this evening. So for the person who asked that question, definitely try to come to my masterclass tonight and I can I can answer more of these questions in more detail. I'll show you slides and pictures, and I'm really visual when I like to teach. So I like to do that. And unfortunately can't do that here on IG Live. So, okay. And then someone asked, how can we work with you? Well, first step, I would say come tonight to the masterclass. If you can't come to the masterclass tonight, then definitely you can take our free assessment. Also a link on my profile. And then if you can't do either of those things, which I do recommend you do the assessment, because then you can kind of see, you can see all the questions that I asked to really understand the root cause. It is a quite lengthy assessment, but it's so lengthy because it's really trying to get down to the root cause. Like, what are the real issues? The masterclass is at 6:30 tonight, Pacific Standard Time. If you guys can make it, it's great, because then I'll answer questions live. If you can't make it, I would still recommend you sign up, and you'll get a replay of that masterclass as well too. But if you come to the live, you'll be able to ask a bunch of questions, which is really great. Okay, let's see. How can you let us know which vitamins to take? So definitely that's something that that we do at Clean Body, is we have lots of different ways we can support you. We actually do have a course or a membership if you wanted to just learn. So I would recommend you start there. If you want to work with us directly, if you want us to analyze your case, if you want us to investigate for you and do labs, then I would recommend you do my class tonight or do my assessment. That will kind of give you a little bit of an idea of the approach we're taking. At the end of the assessment, I also have a video there kind of explaining everything. And then you can book a discovery consultation with me so we can work really closely. If you're interested more in learning, then we have a course and you can actually access that directly. Also a link at the link in my profile. It's called the Essentials course, okay? What's the recommended calcium amount for breastfeeding moms? Okay, and I think the same person had a question about breastfeeding and how does that affect our kids with eczema. And yeah, it really does. So, I think whenever I treat kids who are breastfeeding or babies who are breastfeeding, I always need to also take care of mom as well too, because mom can often be transferring some of those toxins onto baby. So something we need to pay attention to. So I might test mom for toxicity. I could also test mom's breast milk to see how many toxins are coming out, heavy metals, etc. And that could be really important. In terms of the recommended amounts, again, this is all information that can be found in my course or my membership, which is the Essentials course, which you can also click the link in my bio for more information. And all of that information, we actually have so many resources in our portal if you do decide to join that, and a very inexpensive way to just kind of learn all this information. Okay? All right, great. I want to open up to any other questions that you guys have, and I'm happy to answer those today. I may have missed some questions. If you're still here, please go ahead and type them into the comments. I'm happy to try to answer those now. And if you can make it to tonight's free masterclass, it's at 6:30 p.m. Pacific Standard Time. I will be sharing a bunch of slides. I'll teach in more detail from what I'm talking about here. And that's a really great way to get your questions answered as well too. And I'll have a lot more slides and things so I can explain in more detail. What is the best way to remove heavy metals, chelation, IV, or pills? Or great question. Every person is different in terms of how I want to chelate them. For those of you guys who don't know what chelation is, this is the process of binding the metals, pulling them out of your tissues, and excreting them out via your urine and even your poop, okay? And I like to use lots of different ways. I like to do DMSA pills. I like to do also IV chelations. I also will use herbs like chlorella, cilantro, things like that. It really depends. And everyone is different. Some people won't be able to tolerate certain versions of chelation. Also, it's always not the right time to start with chelation. Oftentimes I actually want to get the funnel cleaner. I want to get the liver moving. I want to get the gut moving. And finally, at the end, we do chelation, because if you chelate before a system is ready, then what you're going to do is pull out toxins and they're going to have nowhere to go. So some of you guys who might have done detoxification or chelation and you are still constipated, well, that's really bad, because you are going to be pulling out all these toxins and they're going to have nowhere to go. You're probably going to notice that you're going to get some symptoms, detox reactions from that. Let's see. Currently a breastfeeding mama and getting allergy shots for myself. How is this affecting my baby? Pros, cons. Yeah. You're allergic to things. Often in my practice, my recommendation there is, let's find out why. Oftentimes you're allergic because your funnel is overflowing, because you have a lot of burden on your system. Maybe your liver is dysfunctional. Maybe your gut's not working properly. I know this personally. I used to be allergic to shellfish, so shrimp and crab and lobster. And that was when I had really bad eczema and I was car sick all the time and I got headaches all the time. I had IBS, etc. When I healed all of that and I healed my funnel, I can now eat shrimp. It's quite amazing. Every time I eat it, I get a little scared. I don't eat it often, but when I eat shrimp, I do not get allergic reactions anymore. And now I wouldn't say necessarily this is true of everyone, but I really have noticed intolerances and allergies. A lot of them can be healed if you heal the core of the body. So allergy shots are working in a different way. They're, in my opinion, not necessarily getting to the root cause. And so I would want to understand your root cause for this person who's breastfeeding, because, even though you're doing the allergy shots and maybe the allergies might get better because of that, is there a root cause that is harming both you and your baby and you just kind of don't know what that is? So I'd like to identify that. So let's do some investigation and then let's clean you up. Now, when you're breastfeeding, the cleanup process is a little different. We can't really clean you up as much as I want, because if we detox you, those toxins might come out onto baby. So, we have to be a little bit special about how we're going to go about your cleansing process. And if and when you stop breastfeeding, then we're going to go really hard with the cleansing. But if your baby has eczema right now, we really want to understand, well, how can we make it so that your baby, the toxins aren't transferred onto your baby, but that we can cleanse you in this way that they're not transferred onto your baby. Okay. Wow. It's amazing healing the core of your body. Very powerful. Yes, it is so amazing. And when you heal the core of your body, everything else gets better. So I know that we're talking about eczema today. That's one of the main things I love to treat, just because I myself was an eczema person. But all of the symptoms people are experiencing, from headaches to gut issues to hormonal dysfunction to autoimmune disease, etc., really the core of the system is dysfunctional. And usually it's that all of these detox organs are really, really burdened. So when we clean those up, everything gets better. It's just amazing. Things that you wouldn't even think would get better will get better, from, like, oh, my back hurts all the time, and that's getting better. So it's quite amazing. How long does it take to remove the heavy metals generally, and is there always some left? Do you treat patients differently based on the toxins in their bodies? Okay, good questions. How long does it take? It is different for everybody. First of all, everybody has different amounts of heavy metals and toxins in their body. Everybody has different exposure. So is it fixable? Yes. Is there always going to be some measurable amount of heavy metal in the body? Well, that's a different question, because we also need to make sure you're not exposing yourself. You're not continuing to expose yourself. So there's two things we need to do. We need to clean up the heavy metals, and we need to make sure you're not exposing yourself as well too. Okay. I treat everybody as individuals. So we do have a course and a membership where you can learn about our general protocols for cleaning the gut, the kidney, the liver, and flushing your bile. But if we work together individually, if we have a discovery consultation together, I'm really deciding, how are we going to customize this? How are we going to investigate your health? I don't have a general set of labs I do for everybody. I have a set of labs that I'm going to do for people because I find they have X, Y, and Z. They have these exposures. Their eczema looks like this, or their picture looks like this. that, and this, and that's why I would do this test, and this test. And then based on what I find, everything is going to be customized to what I find. So not two people in my practice who work directly with us at Clean Body are going to get the same protocols. There are some generalized protocols that we will customize, and then people will get completely different protocols based on what we find. Okay. What is the best way to clean up heavy metals? I already answered that one, so you can check the recording of this to see that answer. I'm currently 7 months pregnant and have experienced bad eczema, flare, and TSW since October. What can I do to detox slightly? And are there any topical ointments or creams that truly penetrate? How do I get a consultation? Okay, let me answer those. I may miss some of these because you guys are kind of going faster. Oh, I'm so sorry to hear it. So I know exactly what you're dealing with. I had eczema my whole life. And then when I was pregnant, I could no longer use my steroid creams because I was pregnant and I did not want to harm myself or my fetus. And so I stopped using my steroid creams and I got TSW. For you guys who don't know it, it's called topical steroid withdrawal. Oh my goodness, this is the most horrible thing because you're so uncomfortable because you're already pregnant and then your skin is on fire and it's just so painful. There is absolutely a way to work on this even when you're pregnant. This absolutely has to be, we have to work together. You cannot do our course protocols because you're pregnant. So we need to work together to figure this out for you and how to do it safely while you're pregnant. We cannot full on detox you, but we can support your system to heal and to allow those toxins to go out the right direction and things that would be safe for a pregnant woman. The reason I became a naturopathic doctor, it was actually after I was pregnant and, midway through my pregnancy, I was just so frustrated at my wit's end having TSW that I saw a naturopathic doctor. And that's the type of doctor that I am. We really try to get to the root cause. Within a couple weeks, my eczema had really significantly gotten better. And that is why I am sitting here before you as a naturopathic doctor and completely healed because I myself went through the process that, I know that you guys are really going through the process of looking for answers. So for me, I really had to go to medical school and figure this out on my own. What I hope with all these classes that I teach, with the course that I have, and working with people individually is that we can really teach you and empower you so that you don't have to go to medical school to figure this out on your own, but that you have all the tools and the resources you need to really get to the root cause. If you guys want to book a consultation, that was another question that someone asked earlier. If you go to the links in my bio, there is a button called Book a Consultation. If you want to learn more before you decide to book a consultation, you can go to my masterclass this evening at 6:30 p.m. Pacific Standard Time. And I also have an assessment. A pretty lengthy assessment, takes about 10 minutes to complete. And if you're having a hard time filling it on your phone, do it on your computer. And I recommend filling that out because it really, it shows you how you get to the root cause by asking all of these questions. And you'll see how congested your funnel is and, how the foundation of your health also needs some work as well too. And then I have a video kind of explaining what those results mean. So some other ways if you want to learn about what we do first before you book a consultation. We can work with clients from out of the US, but unfortunately I personally can't work with you. So you can work with one of our coaches, and one of our coaches can really support you through the program, help you with the nutritional and lifestyle aspects of the program. But unfortunately, because I'm not licensed outside of this country, I won't be able to help you from a naturopathic medicine perspective. But with that being said, everything that we have in our program and the coaching really, really helps in terms of helping you to identify how to get to the root cause. And our coach can give you some support with your own local doctor, like what tests can you do? The coach can help you with your own local doctor in terms of what tests you can do and how your local doctor can support you more if you can't find someone like us in your country. Okay. All right. Does the weather affect the skin? Absolutely. The weather affects the skin. So, everything from the humidity to the dryness to the coldness will absolutely affect your skin because our skin is a barrier protecting us. So temperature changes and humidity changes are all going to affect how our skin reacts. So this is a big reason eczema patients get worse in the winter, and sometimes they get worse in the summer because they're sweating, etc. Okay. All right. Last two questions here. What natural topical should I be using daily for plaque psoriasis, and what daily soap? Really good questions. These are questions that I do have lots of resources for in our essentials course. So something that you can check out. We actually have links to all the recommended products that we have. Off the top of my head, I really like Waxoline. It is dermatologists often give Aquaphor, and I like Waxoline as an option for keeping things really moisturized. Daily soap, I like things like probiotic soaps and things like that instead of real soap. Again, if you want links to all of that, you can join our course. Really inexpensive way to kind of get access to all of our resources and links and all of that, okay? Any good moisturizers that you would suggest for eczema? Just answered that. Looks like you guys have similar questions. And thank you all. This definitely needs big time awareness. Gut health is so important. Yeah, absolutely. So I love doing these. I think that, it gets the word out there, and I'm happy to really answer all these questions because, as I said, I myself was on the hunt for all these answers. And back then, which is now 15 years ago or something like that, there was not Instagram, there was not all of this and all of this knowledge. I think this is so awesome as a way to connect with people and really get this story, this answer out there. It is life-changing. Truly life-changing, and was life-changing for me. I'm sitting here and, when I do these videos, I do like to wear show my arms, because I used to have eczema all over my arms, all over my neck, all over my face. So I know what it's like from a personal place. So I hope this information has been really helpful to you. If you want to learn more, check out my masterclass this evening, 6:30 p.m. Pacific Standard Time. If you can't make it to that, there is a replay on that website as well too that you can click. You can see my past live masterclass. And I'll end with this last question here. Do I think Dupixent is worth it? Dupixent is also just another Band-Aid until things get better. Does it work? It does work for some period of time. If you go on my website, if you see one of our people, she had been on Dupixent for 3 years. It worked great for her for the first couple of months, I think. And then she started to see her eczema come back, I think after a couple months. And then 3 years in, she's still using it. It was still helping so that she didn't have eczema everywhere, but she had eczema, and you can see the pictures. We are actually releasing a video of her and talking about her process very soon. But then you see her 3 months later when we really clean everything up, and everything really comes down when we get things out the right direction. Okay. All right. You will go to the link in my website. On my profile page, the link on my profile page, and that has a bunch of links. And the one that for the class tonight, you will click the one that says free masterclass, and then you can either sign up for the live tonight. If you can't make the live, we will send you a replay of that, so just make sure to sign up anyways. If you want to just watch my live a class right now, and you're not available this evening, then you can go ahead and watch the replay, which is also on that site as well too. Okay. I found out I have a fat and oil intolerance. Do you have experience with? Oh, absolutely. So almost everybody with eczema is going to have a difficulty with fats. Okay. And that is because your liver and your gallbladder are likely congested, and your bile is really one of the ways that you metabolize those fats. And so it is such a big part of our process is really understanding bile and liver. And most of the time, almost every eczema person, whether you're young, whether you're old, you're going to have a problem with fat. And that was my problem too. And back then, I would crave butter. I could eat a stick of butter because my body actually needed fat, but I was unable to digest it properly and metabolize it properly. I would crave it, but then when I would eat it, it would make me feel sick. So, and that's just because my body had a hard time metabolizing it. And I'll talk more about that at my class tonight. So if you guys are available, 6:30 p.m. tonight, and I do have to head out now, but it's been great just hearing all of your questions. And if you have more, definitely come tonight, because I will be live. I will be answering all the questions. Bring a list of questions, and I'm happy to answer all of them. Okay. All right. It was great chatting with you all, and I will hopefully see you tonight. All right. Bye, everyone.